Hi, I'm Josh Hernandez. I'm the respiratory therapist here at the Encore in Boca Raton, Florida. February is Heart Month, and as we know, the heart and the lungs work together for a patient's cardiovascular, cardiopulmonary system. So what I'm here to tell you about is inspiratory muscle training. When a patient has inspiratory muscle training, they are allowed to, if they happen to have high systolic blood pressure, it can be preventative and therapeutic for them. So what I'm here to show you is inspiratory muscle training. And it's quite simple actually. For instance, it increases muscle strength and endurance. So the patient is able to, for instance, do physical activities longer and without running short of breath. Not only that, but it also decreases dyspnea, which is short of breath, hospitalizations, needs for medication, hospital visits, any of that thing. It's something so simple that really does great things for the patient at the present and in the future. Okay, so this is based on the concept of progressive resistance. I mean, it's kind of like muscle training. The more you lift weights or the more muscle workouts you do, you go stronger and you can go further. Same thing. So when the lungs become stronger, it's more resistance is added and you become less short of breath and longer to do, as I said, physical activities. Over time, as you're doing these training, over time more resistance is added and you keep increasing the strength and the endurance. However, before this training begins, what we need to do is get a baseline for the patient. You get what's called the MIP, maximum inspiratory pressure. And what you need for this is what we call a manometer pressure. And you get this for the patient, like as I said, for a baseline. Now, first thing you need is a manometer pressure. And the way this works is you have the patient completely exhale out down to what's called the RV, the residual volume. It's the air that's still in your lungs, even if when you've exhaled everything possible, there's still some air in those lungs. So you exhale completely out. And there's this inspiratory port on this pressure manometer. You cover that for 15 to 20 seconds. And you have the patient inhale as fast and as hard as possible for those 15 to 20 seconds. You do this about two times, and you record those baselines, those numbers. Anything less than 20 centimeters of water is considered inspiratory respiratory weakness. So this where it comes in, inspiratory muscle training comes into play. So you get the patient relaxed and in a comfortable position. You tell them to relax his abdominal muscles. You set the resistance to the lowest possible resistance, and you have the patient breathe in and out slowly. If the patient's inspiratory pressure is less than 30% of the MIP measured, then you increase the pressure, you increase the resistance until it is achieved 30%. You do this 2 to 3 times a day for 10 to 15 minutes until the patient is able to achieve 30 minutes per session. You keep doing this, and the patient's inspiratory muscle training will be a success. So just remember, always pay attention to signs or symptoms that you may see on a daily basis. Anything that you feel is different, seek a medical advice. Read up on it. Anything helpful to prevent further ailments would be great. As I said, this inspiratory muscle training will help prevent and be therapeutic for patients with high systolic pressures, good for hypertension. Thank you for watching this video. If you are struggling with heart health issues, use these tips wisely. It'll be very beneficial for you. If you know anybody, family or friends struggling with heart health issues, share this video with them. Show them these tips. It'll also be very beneficial for them as well. I hope you consider all these tips that I've shared with you and have a good day.